Hi guys, this is Jewel, and I just wanted to do a little education with you on how to use the thermometers that you might encounter at the screening stations. So we've got here like 4 different ones you may see, and so we're going to kind of go over the use and the advantages of each of those. And Kim is going to help us out today, so thank you so much, Kim, for your help. And she has got all of the PPE on that you will have on as a screener. And so she's got her eye cover on, she's got her mask on, her gown, and her gloves. So that is what the screeners need to be wearing. So the first thermometer is going to be the infrared forehead scanning thermometer. And you can kind of see on the thermometer, it tells you on this little section here pretty much how to use it, but we're going to demonstrate that as well. This is the preferred thermometer because it's no touch. You don't have to touch the patient at all. So that's probably the one you're going to be using. But if you had trouble with this one, all of the screening stations have a second option as well. On this side of the thermometer, I just want to show a few buttons that you may need to mess with. This one has body and surface. We want to make sure when we turn it on that we are under the body option. The surface option is going to give us an inaccurate reading. So the way you use this is you come to your patient and you just ask them to stand still, and you don't have to touch their forehead. You can see here it says distance is 5 to 10 centimeters is how far away you get from their forehead. So you just point it, pull the little trigger, and wait for it to beep. And you can see here, her temp was 97.7, and it says body up in the left-hand corner. Now, if that would say surface, then it's going to read much lower. So I'm going to change it to surface just to show you. So it says surface temp there. If you see that, it's going to give you an abnormal low reading. So you would just press this button to change it to body. So if you're getting readings of 89, something like that, then you're probably on surface. So a normal adult reading should be anywhere from 97 degrees to 99 degrees. For kids, their range is a little bit different than that, but if you can kind of remember, 97 to 99 is a normal temp for an adult. Anything over 100 is considered a fever, and those are the patients that would be screening positive. So this is the infrared forehead scanner. Another one you might encounter is an ear thermometer. So this one, again, is going to require a little more contact with the patient. The first step is just to press the button to turn it on, and you can see that it's going to tell you to put a probe on. So I'm going to just press down in the little probes, and you can kind of hear a click. And then you will just place that in the patient's ear. And again, I'm pressing this button here, and you wait for it to click, to beep. You hold the button down, wait for it to beep. And you can see there, it's giving me the Celsius reading. And we typically use Fahrenheit, but you see it had a C. Oops, I'm going to get it back. So 37.3 Celsius. If I press this button here, it's going to change that to the Fahrenheit number, which is what we would use. Okay, so that's the ear thermometer. And then you would just discard, let's get the trash can. Discard, by pushing this button, you discard the probe in the trash. Okay. Next is the oral thermometer, and you will simply, to turn this on, you remove the probe from the thermometer. You can kind of see the screen. And then I'm going to put a temperature probe cover on. Again, I'm just pushing it down until I feel it click. And I ask the patient to go ahead and remove your mask. You want to make sure that this is under their tongue, and then have them close their mouth but not bite. So you want them to close their mouth and not bite. And you will see that little line turning around till it beeps. And hers is 98.6, which is perfectly normal. And then there's a button on the top. Where's the trash can again? and then you push the button to discard the probe. Okay, so that's the oral. And so lastly is our temporal thermometer. So this is one that's real easy to use because there's only one button to worry about. And so this one does touch the patient's skin, so it's going to need to be cleaned well in between every patient. So if the patient's forehead is not clear, like if they have hair or a hat or anything, you're going to remove that from their forehead to make sure it's clear. You place the little probe, it has to be flush on their forehead. So you put it flush on their forehead, and then you press the button and you just swipe it across their forehead. Keep the button pushed down and touch their neck, and then let up on the button, and you can see hers was 99.2. So I'm going to go through that one more time because I know that's confusing. I push the button down, scan across her forehead, keep the button pushed down, touch her neck, let up on the button. Okay, 98.7 that time. Okay, so I hope that helps with the use of the thermometers. If you are not clinical and you're still uncomfortable with them, feel free to reach out to any of the clinical managers or your educators, and we would be glad to help you practice any of these thermometers anytime. Thanks so much.